Well, thank you very much for having me here today. Assistant Secretary, I appreciate being here with you and you're being here with us, and also to the board. It's just amazing that you found this issue to be of interest to you and you're moving forward with your violence prevention in the area of elder abuse, and I applaud you for that. Thank you very much. I am going to try pushing that. I have to hold it up. Okay. I do represent the International Network for the Prevention of Elder Abuse, and I'm going to speak to you about our efforts internationally and a little bit about the network itself very quickly, but I'm just going to go to some of our international efforts, particularly with regards to the open-ended working group on aging and our efforts with regards to working towards a new convention for the human rights of older persons. As you can see from the slide, we were established 15 years ago, so I'm going to tell you about 15 years of our action in 15 minutes, although my clicker doesn't work. I've never had anyone help me with anything, so thank you. I really am capable. We have representation in about 60 countries throughout the world, and right now we have a president from Canada, Gloria Gutman, and our past president was from Argentina for many years with Leah Deichmann. I think you know Dr. Deichmann, some of you. She's a geriatrician also. And Nabil Kronfel, who is from Lebanon, who's also a physician. Myself and Robert Brent, who is an economics expert in Fordham University and does work on HIV/AIDS, and also did one of the only, I think the only work on what does it cost not to intervene in financial exploitation. I think he said it cost $36,000. So, you might want to think about that. We'll ask Robert for his work. Our organization, of course, acknowledging diversity of culture around the world, and we've talked a lot about cultures today and differences of the way people live and perceive things, so we take that very seriously. But we aim to increase society's ability through our international work and collaboration, importantly, to recognize and respond to mistreatment of older persons in whatever setting we find them in. So why? So that their older years and later years will be lived in dignity and peace and quiet and free from abuse, neglect, and exploitation. We work on elder abuse awareness, of course, promoting education and training and advocacy on behalf of abused elders. We try to stimulate research. That's part of the research agenda that was started some many years ago. However, as you know, this is the group doing the research, so we don't have much more to stimulate, unfortunately. We'd like to have money. We'd like the many governments to contribute to help you. I'm not going to dwell on the Missing Voices report except to thank Alex for bringing it up and discussing it fully and going through some of the focus group issues. But that was the seminal work that WHO and INPEA did in 2002. And I think it remains one of the foundational pieces now. To tie us into health aspect with regards to elder abuse. Elder abuse, as many of you have mentioned, deals with self-neglect and bad outcomes in health are all tied into that. And our past president, Leah Deichmann, who was a clinical geriatrician back in London many years back, I think 20 years at the time I had met her was when she had been in London, and she started to see a number of cases of self-neglect. And that became interested in it. And then, of course, we were lucky enough to have a wonderful health education, a nurse, Elizabeth Podniks, who also had the medical background and the vision to see that elder abuse indeed was a health and human rights issue. So we've been working on that for years and trying to get the allied health professionals to understand that too. We felt that that was our responsibility. And so we did train the trainees, and we started with one in Havana, Cuba, many years ago, and we had 70 allied medical health professionals from the area around the Caribbean, around Cuba, come to that. And they wanted to know everything, and they wanted to know was what they were doing right. Did we, from the U.S., think they were doing it right? And this is what they want to hear from us. They look to us. They turn to us, and they need us to help and to help them, cure the ills that they have. Then we did some in Argentina and Puebla, Mexico, 2 days of allied medical training there. And then most recently, I did some trainings in Nepal. These are just some pictures of some of our associates, Dr. Pereira from the Dominican Republic, and who helped us in the Latin America area. But I went to Nepal a couple of years ago for a month and did training on elder abuse and with the informal caregivers of the world. Let me tell you, this is as informal as you're going to get. As you can see, we had a setting. We didn't have electric. We didn't have air fans. We did what we could with the groups that came. But they were the caregivers for those who have no family, have no friends, for those who are unbefriended or forgotten elders. And as you heard so many of you talk about the filial piety, the experience and the cultural understanding of caring for the elders in many countries, which personally I have to say, I don't think it's any different here. I feel the same way about my family. Who here doesn't? Nobody. We all feel the same way. This is not a divide between us. It's just that we do it in a different way. They needed to know about issues of elder abuse, and I went and I talked also about dementia. I'm not a dementia expert at all, but I am somewhat versed in behavioral issues that are harmful both to the patient and to the caregiver. And I talked to them about that. They didn't know the word dementia. They didn't understand what was happening with the brain. Things were happening because of this, not knowing, of no training in gerontology, not a single periodical book publication on aging issues, bringing this information to them, traveling around the country and giving these groups who went back then and trained their villagers. They were the leader who came, and then they went back and trained their groups. It was a tremendously important mission. And this is something that I call upon all of us to help to do in these countries that are struggling for any information that we can get them. And we went with this 87-year-old doctor he was a chest doctor. I really loved that he was a chest doctor. I think he was a heart doctor. But he traveled with us 9 hours in a Jeep with 9 people in it, up and down mountains, to bring issues to these people. They didn't know what constrictures were. They didn't know that to open the hand of someone whose hand was stuck was painful. They didn't understand what the problem was. In moments, in days, we changed so much. It just really, it's very empowering. You mentioned, some of you mentioned Dr. Rosalie Wolfe earlier, who actually established INPEA 15 years ago. And we do have a standing award, an international award each year for her also. And Dr. Kalache was one of the very earliest who received that award for his work with WHO. And of course, you've heard a couple of times now how with our World Elder Abuse Awareness Day, and particularly because it was the dream and the wish of Dr. Elizabeth Podniks, that we all worked so hard for her, because so many of us were devoted to her and wanted to, not just to her, but also to this issue. We wanted the world to be aware of elder abuse. And so she established this with us back in June, and Betty Malks is here, and Betty was part of that at the WHO with Dr. Kalache. And we went for several years until the World Elder Abuse Awareness Day was an institution worldwide. People thought it was an international recognized day by the UN, but we didn't tell them it wasn't. We just let them think what they wanted. And we didn't say it was, but it was recognized by us. And now the UN itself has recognized it as an official day of commemoration due to the hard work of Argentina and Dr. Deichmann, again, who is very connected there, works very hard in Argentina, and Rosa Perla Resnick, who is one of our representatives in New York. So what do we do in New York? What do we do in Geneva and Vienna? We work in our NGO team to bring the rights and the voices of older persons to the attention of the member states, to other NGOs, and to other older persons themselves. Because as you said, Dr. Kalache, in that meeting that we had, older persons need to know they have rights. So we have that mandate also. So we're promoting older persons' rights through advocacy and education, because we have this special consultative status at the UN, so we are allowed to speak 2 or 3 minutes, maybe every other session or so. And we also have an affiliation with DPI, which is the Department of Public Information. And so 2008, Department of Public Information, which shares information throughout the world of interest, we put on a program about social isolation. It was the very first time they'd ever talked about these issues that are dear to your heart and are the basis of protecting older persons throughout the world. So it was a first. Well, so far it was the last, but we'll have another, I'm sure. But that was just DPI. We're very busy in other areas. And some of the people in this room participated in the Second World Assembly on Aging in Madrid in 2002. And then since then, there's been Madrid follow-ups, the 5-year and then the 10-year. So we just experienced the 10-year, and our organization has been very active in all of those. Now we'll see how this works. This is just not to frighten you, but this is just to show you all the different areas of intersection that we have as an NGO with regards to the activities within the United Nations system. So we interact with them, and unfortunately I can't see it from here. But I know what we do. We interact with them, we intersect in all the different areas, except maybe the Security Council so far, but we might go there. So we go to meetings and sessions, and then there's a calendar of meetings around the year, and it sort of starts in January with the Commission on Social Development. Well, after working and working for years of, photocopying and carrying paper, I finally became the co-chair this year. That's how you get to be the co-chair, okay? You do the photocopying for 3 years. But why would I do that? Because we needed elders and elder abuse issues on the dais. And so I was able to suggest someone, and Bethany Brown from HelpAge International, who I had hoped would be here at HelpAge USA, was the speaker, and she gave a tremendous, almost a dissertation on the needs and statistics on older persons from around the world. And so that was the first time that was so fully discussed, and we're very proud of that effort. Also, we go this year we went to the Commission on the Status of Women. Now last year we engaged with the Commission on the Status of Women, but it was our first year because we were very busy doing other things, and there's only a few of us. But we said, the Commission on the Status of Women has not mentioned older women at all, and we're not going to stand for it. And so Pat Brownell and I, who is my mentor, my lead in New York City, we just said, we're going to get it on there. So not only did we get it on there, but Pat Brownell gets invited to sit at the dais with Michelle Bachelet, the director of UN Women, right there, and she talks all about the needs and issues of older women, which I really think that elder abuse is an older women's issue. So another first, an amazing situation, and now they can't ignore us. All right, we're in. We have intersected in 2 of the huge MIPA reviews, the one in the Latin American Caribbean area. I think that Alex may have alluded to that. He was involved in that also, in the Mesa Rotonda, yes, on non-discrimination and equality that we held as NGOs. And then our voices as NGOs went into a document, and that document became part of the outcome of the ministerial meeting. And so the power of the people who came and the NGOs who put input into that was really terrific. So those are just a few of the things that we've done. I've got some more in the written information. You can read it another time. And on our website, you can see everything that we've done, I hope. So what I just wanted to talk to you about were some of our urgent concerns. I told you were older women and widows in particular. And you've heard of some of the cultural and traditional practices that are very harmful. We just mentioned them briefly. I mean, they really deserve a whole day of discussion. I mean, when you think of 500 older women being killed because of witchcraft beliefs and practices in Tanzania, well, I was in South Africa last year, and guess what? They had about 500 reports there, and they were having a big meeting on it, too. And so also in the western, northwestern part of Africa, many areas, there are camps where some of these widows have to go to hide, be protected, because they're seen as the enemy for unknown things, for suspicion of things and stereotypical issues. They live in extreme poverty, their property is taken away, some of the widowhood rights were mentioned. They're very difficult even to believe, let alone to study and to know. The issue of extreme poverty is something that has come to the forefront of the open-ended working group. Also, that's going on. It was alluded to a little bit, I think, in a couple of discussions, but I wanted to tell you what is the open-ended working group on aging. It's a group that came together with a mandate from the Secretary General and the resolutions to look into the gaps and the issues around the rights, the protecting the rights of older persons, internationally. And there were 3 meetings so far, and a lot of really good information came, a lot of good support came through. So towards moving towards whether it would be a 4th meeting or not, or the issue would just be pushed under the rug again, there was very strong effort by El Salvador and some other countries and some African countries also to have a resolution to change that working group into something that would actually work on input into a possible new instrument, which means a new convention. Okay, that's a new instrument. Some people won't say the word new convention, but I will, because that's what we want. We want a new convention on the human rights of older persons. And so we had opportunity as NGOs, as you can see, to input. But what's coming up now is, I'm just going to do it quickly, is we are planning in the global alliance that we have. We came together with 9 other NGOs, and Alex Kalachi was our mentor, our senior person. And what we're going to be doing now is to sending out amongst civil society and all the NGOs, et cetera, all the professionals we can. And we want to come into a collaboration on a statement of principles. What would people think, or what do people think are essential elements to be in a new convention? And so we can inform the member states, we can inform other NGOs. So we're going to be starting this by sending out a survey of sorts, online, but also we need your input. We need you to tell us, where do you intersect with local groups? Around the world, what context do you have? Can we bring our questions to your groups at the grassroots? There'll be a meeting in Cameroon soon that IFA is hosting. We'll be talking with NGOs there. We have a short time to do this because we want this information ready for the August open-ended working group. But what we would like is, to get real input from the ground up. And so I'm calling out to you and asking you if you can help me identify some stakeholders that we could involve in this. And I can always talk to you about that later and send you some information. Because we believe that having a new convention on the human rights of older people would help older people live in dignity and free from abuse. If that's all that I get to say, and I have to stop now, I want you to know that I think that you all agree with me. And we really do need the support of each of you. But more importantly, as Assistant Secretary Greenlee, you said when you started that we are global leaders, and we are. There's nowhere I go that this issue doesn't resonate. And when they see the U.S. and we're there supporting it, everything else that anybody ever thought was all good goes. This is what's important. We are together on this. It must be them and U.S. Please. Thank you.